Ready?
Yep.
Hi, my name's Caitlin Gosson, and I'm here to give you a speech today on ankyloglossia. I know we've all been tongue-tied at least a time or two in our lives, but did you know that it's actually a medical condition? Ankyloglossia is commonly known as tongue-tied. It's too hard to pronounce. You are born with it. It's something you're born oh my god. You're born with it. It's what happens is your lingual frenulum is attached too closely to the tip of your tongue. Your frenulum is this little piece of tissue under your tongue that connects your tongue to the bottom of your mouth. It basically holds your tongue in place. So I've got a little diagram here, and this shows you right where it is. Today I would like to inform you about what ankyloglossia is, what the effects it has are, and what your treatment options are. Like I mentioned earlier, it's a short lingual frenulum, and it's attached too closely to the tip of your tongue, and it restricts the movement of your tongue. There's no known cause for ankyloglossia. It may be hereditary. It affects about 4 to 10% of infants. It's also more common in boys, with a 2-to-1 ratio. How it's diagnosed: the child will start to show symptoms, which I'll talk about later, and then the parent will take the child to the doctor, and the doctor will perform an oral examination. What happens in that examination is basically the doctor opens the child's mouth and looks under his tongue. Obviously, if it looks like it's attached too closely, then the child has ankyloglossia. If not, then the child's fine and the symptoms are coming from somewhere else. Now, the effects that it has on children are most commonly feeding difficulties. When a baby is born, most of the time mothers will breastfeed their child. What happens when a child has ankyloglossia is he has a hard time latching to the boob. And so the child will latch and detach often to preserve its airway, because the tongue is not formed correctly. He can't breathe properly. These difficulties often lead to early weaning, meaning that the child will stop breastfeeding sooner than he should. Another effect it has on children is speech difficulties, which obviously can't be detected in infants, but it can be detected in older children. What happens is, most of the time it causes a lisp. Now, I have a niece and a nephew that both have lisps. They both had the surgery to fix their ankyloglossia, but it didn't work. I will talk about that later. They have problems pronouncing sounds such as and their L's and their T's and S's. Now that you know more about the effects that it has, I'll tell you about the treatment options. This here is a picture of a lingual frenulotomy. It's basically where they snip that frenulum. All they do is take a little scissor, lift the tongue, and snip it. It's a quick procedure. All it requires is local anesthesia. There's nothing to do afterwards. It's simple. The baby is then given back to the mother and continues breastfeeding. Now, when you have an older child, you'll receive what's called a lingual frenuloplasty, and that is more intense of a procedure. They actually slice right up the middle of the frenulum rather than just snipping it in half. Now, that requires general anesthesia, and it's usually used in children that are older than 2. between 1 and 2. That requires general anesthesia. And then another treatment option is speech therapy. Speech therapy is common for either the parents that opt not to have the surgery, or when it's not completely effective. When you have your tongue snipped and you still have difficulties, like my niece and nephew, for example, they're now 7 and 4, and they still have speech difficulties due to their tongue tied. So they see a speech therapist between 3 and 4 times a week to correct those problems that they're still having with their speaking. So in conclusion, now I know that all of you know what ankyloglossia is, and you know what effects it has and the treatment options for it. Next time you think you're tongue-tied, you might want to think twice. Thank you. You can stop.